Of the King George County Board of Supervisors. I hereby invoke the rules and procedures previously adopted by the Board of Supervisors and allowing for electronic participation by some members with a quorum physically present. This action is taken as a result of the COVID-19 pandemic and the governor's orders regarding limiting of gatherings and staying in place during a disaster. Electronic participation is encouraged, and pursuant to the governor's emergency orders, social distancing shall be maintained for all physically present. If you choose to be physically present, you will be screened by authorized staff for signs and symptoms of illness. Based on the results of that screening, certain physical attendees may be denied. The following members are physically present. We'll start with you, Mr. Stonehill.
Present.
Ms. Kupka?
Present.
Mr. Bush?
Present.
Kathy Binder, present. The following members are participating through electronic and remote means after notifying the chair that temporary disabilities and or other medical conditions exist that prevent the members' physical attendance. Mr. Granger? Mr. Granger online?
Madam Chair, they're having an issue trying to hear us online. Can you hold for a second, please?
Yes, I can.
Thank you, ma'am.
Mr. Dines?
Okay, Madam Chair, I think they should be able to hear us again.
Mr. Granger, do you certify that you are remotely?
I so certify.
Thank you. Notify the chair that temporary disabilities and other medical conditions exist that prevent the member's physical attendance. I direct the clerk to include the statement in any statement of remote participating board members to be memorialized in the minutes. Dr. Young, is there any amendments to the agenda?
Yes, Madam Chair. I'd recommend the board amend the agenda to remove Captain Copeland's presentation from the agenda. He won't be able to attend tonight.
All right, thank you. Is that the only change?
Yes, Madam Chair.
Do I have a motion?
Move to amend the agenda to strike 12-10 presentations and reports, NSA South Potomac Commander's update by Captain Copeland.
Do I have a second?
Second.
Any further discussion? All those in favor say aye.
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 Aye. Aye.
Any nays? Chair votes aye. Motion carries. Next up is public comment. Comments will be limited to 3 minutes per person in order to afford everyone an opportunity to speak. If comments relate to a specific public hearing item, we ask that you offer those comments at the time of the public hearing. Is there anyone in the audience who would like to come up and speak at public comment? Please come up to the podium. All right. With that, is there anyone online who would like to speak?
No, Madam Chair.
All right. Do my colleagues have any correspondence that needs to be read? Mr. Granger?
No, ma'am.
All right. We'll close public comment and we'll take reports from members of the board. Mr. Granger, I'm gonna have you go first since you're online.
Sure. I appreciate it. I'll be brief since I'm remote. Sunday, December 13th, I had the opportunity to attend the tree lighting ceremony. And so I'd like to say thank you to staff for all the hard work they had for setting that up. And I'd also like to thank the Mars Hill Act 17 and the Muddy Creek Choir for providing the Christmas music to celebrate the event. Other than that, today we finally had our first Comrail meeting since the pandemic started, and so it was nice to finally be able to do that. It was in a tele-attendance for most of the people, so I was there and a handful of other people at Mary Washington, so I'd like to thank you to Mary Washington for hosting it, at least a handful of people that were there, and then everyone else that tele-attended it. And it was nice to finally be able to get back to do that, and hopefully here soon we'll be able to actually have face-to-face meetings soon to be able to just socialize with the rest of the communities that are part of the Comrail as well as the base. So I'd like to say thank you to the base and Mary Washington for their support on that. And that's all I have. Thank you.
Thank you, Mr. Granger. Mr. Stonehill.
Good evening, everybody, Madam Chair. Wednesday, December 8th, I attended my first in-person Rappahannock River Basin Committee, which was down in Doswell, Virginia. They were a handful of us that showed up in person. The rest were on a big jumbotron there in the meeting area. We spoke a lot about the water runoff and everything into the Rappahannock River due to all the rain that we've been having. Also spoke about the upcoming scenic designation to the Rappahannock, which they're working on, and it seems like most of the counties have signed on with that, except for a couple of the lower ones. They also talked about, in compliance with the septic tanks and everything, having to do with runoff into the water. Saturday the 12th, myself and Mr. Clark and Brent Hunsinger had a tree giveaway here in the county. That was at Brooks Park, and we handed out a lot of trees. I mean, a number of hundreds of trees were given out for free to all people in the area to be planted back into the ground. We had a really good turnout, a lot of trees. We had probably 3 trailers of trees that were gone. A lot of people had come by and they were looking for flowering trees and everything. We will be doing another one come springtime. That'll be March or April, and we'll have a number of different types of trees. They're all free, so come on in there and come get some trees to get in the ground. I'll keep everybody posted on the dates when we come up with that. Sunday the 13th, myself, Mrs. Binder, and Mr. Granger all attended the tree lighting ceremony. The Mars Hill group and the Muddy Hill Choir did a great job with music, and I wanted to say thanks a lot to General Properties for getting the tree decorated. They did a great job on it. Today, also I sat in and watched the Comrail meeting online, and today, this afternoon, I actually had a site visit with some developers here in the Dahlgren area that are looking to upgrade some of the apartments that are down there. Very good project that they had going on down there. And then, Madam Chair, I have one last thing. I'm just going to acknowledge a tragedy that we did have here in King George County. To one of our local colorful characters here in the county. Roy Fenwick Jr. was killed in an accident this past Thursday evening. Known to many as the mayor of Teetotum, at the time, Roy was doing what he did best and he loved to do was helping somebody out. Roy was a fireman for over 50 years and a life member here in King George and the Colonial Beach volunteer fire departments. Roy has touched countless thousands of people over the years, with his store, Roy Seafood, being one of the first stops for people coming to the Northern Neck to pick up supplies and mostly crabs. Ask anyone where to get the best crabs in the area, the answer was always the same, Roy Seafood. Ask anybody where they could get some firewood and have firewood delivered, same answer, Roy. Roy will be missed far and wide. And Madam Chair, I would like to take a moment of silence for Roy and his family and for everybody to think back on your most enjoyable moments that you spent with Roy. Thank you. That's all I have.
Thank you, Mr. Stonehill. Ms. Kupka?
Thank you, Madam Chair. I definitely will not read everything, just a couple of highlights. First, I do have an appointment to fill. Mr. Josh Cole's term on the Planning Commission will expire on December 31st, 2020. So I hereby move to reappoint him to a new term on the Planning Commission.
Do we have a second?
Second.
Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye. Motion carries.
Thank you all. Last Thursday, the Thursday before, December 3rd, participated in the Mapping the Future of King George County virtual meeting hosted by the Department of Economic Development and Tourism and our Economic Development Authority. I want to thank those departments and our citizens who dialed in for their participation as well. Last Thursday, December 10th, participated in Representative Rob Whitman's elected officials call, joined by Three Rivers Health District Director, Dr. Rich Williams. I have some detailed notes about the coronavirus response and vaccine in my board report that I will post online later tonight. But a couple broadband updates that I thought were worth noting. Last week, the RDOF, the FCC Rural Development Opportunity Fund auction occurred, and it allows providers to bid for 2.5 gigahertz fixed spectrum, similar to 5G wireless frequency, but fixed high-quality fiber. So if they receive the license, they are required to meet milestones. They must have 80% of the connections that they say they're going to make operational by the end of the 5th year, or they will have to surrender the assets and lose access to the spectrum. And this broadband has to more than exceed the 25.3 definition of underserved. So why do we care about this in King George County? Because 146 licenses were granted in King George County. In my report, I will have a link to the results, and we had GIS manager Kyle Conboy, thank you to him, map the census tract ID numbers for the locations granted to be served. And you can take a look again at the link. You can look at the map and then sort by state and then by county. Representative Whitman said it would be helpful for each locality to host a town hall in the next year or so in which the licensees, and right now it's not published right now, but it will be shortly, where the licensees can present to the community what it means and who their projects hope to serve. And so this will allow the awarded providers the opportunity to offer new connections in our community. In the course of asking questions about the RDOF auction, I asked for an update regarding our E-rate request. And Representative Whitman stated he has been in talks with our senators and he intends to provide a legislative fix to allow for the use of fiber purchased under the E-rate program, as well as requirements that it be reasonably priced so families with children, the school students who are no longer in the physical classroom, so that their families can afford to access it as part of a larger broadband bill in the new session of Congress. Nothing is in writing yet, but he is optimistic that it will be supported. And one last thing, I wanted to give a shout out to staff. Thank you to the Department of General Properties team for getting the tree decorated. Thank you for the departments of Economic Development and Tourism, and Parks and Recreation, and Mars Hill Act 17 for the county tree lighting event this past Sunday. As I stated on the Facebook King George community page, when someone made the comment to the effect of, "I'm getting tired of all these virtual events. If you can't do it in person, you shouldn't have the gathering." My response: here's why we have the gathering. We don't cancel Christmas. We just find creative solutions to bring our community together, no matter the circumstances. Thank you, staff. That is all.
Thank you, Ms. Kupka. Mr. Bush?
Thank you, Madam Chair. So this evening I got to sit through a Service Authority meeting, and I was going to make some comments now, but I see it's on our agenda, so I'm looking forward to the discussion on the letter of support for Caroline County. It was a shame that I didn't get to see Mr. Bennett tonight. I wanted to thank him for all of his service. He stepped up to fill the seat on the Service Authority for my district. When I ran, I initially said, and I still believe, that the Service Authority Board of Directors needs to be outside of the body politic. It needs to be run like a business. And I believe Mr. Bennett has greatly contributed to that through his thoroughness in dealing with everything that we didn't know was coming when Ms. Bender and I came on this board. It was just shocking what we were walking into and what Mr. Bennett walked into. And he took that on and he championed that and really turned the direction of the Service Authority. So I'd like to thank Mr. Bennett for his service, and I hope he stays on in a consultant role. I asked that he would consider doing that, and best of luck to him in Florida. Last Wednesday, I met with a prospective nominee for my appointment to the Service Authority Board of Directors. She and I met with Mr. Jonathan Weekly and went over some things with the Service Authority. I feel very confident in the nomination, and I will be making that at our organizational meeting in January. And today I met with a prospective nominee to fill a vacancy, or what's a term expiration on the Planning Commission, and that nominee will be brought forth at our organizational meeting in January. Lastly, I'd just like to wish everybody in King George County Merry Christmas and good riddance to 2020.
Thank you, Mr. Bush. First part of my short board report is I want to thank every one of our citizens and our staff that have done a lot this year. This year, I've probably for thousands of years, a very unusual year, more unusual than anyone when the bell rang to say hello to 2020, a new decade. We never thought of where we would be in a month and a half, 3 months. That March 13th, I kind of look at that day as the day our world changed. Hopefully it will go back to the way it was, depending on what expert you talk to. But I want to especially look out to our staff and thank them for all they've done. They've done a lot. They've learned how to telework. They've learned how to put up barriers, everything to serve our citizens. I want to thank them. I want to thank our constituents that work really hard every day to do everything for their family and help their students in school. I want to thank you, and we're going to make it through it, and I just want you to know that. I bring up family because as a term that some people don't know, I learned a new term this summer, is when you lose both of your parents, you're an orphan. So I'm kind of an orphan now, but I'm not an orphan because everybody in King George is a community and you're all family. And I ask for this Christmas celebration that everyone give your family a hug, and if you got your parents, to give them a hug, because it's really important to appreciate them. I always say that. I wish I could still give my parents a hug, but I know I can speak to them up there. So just make sure you love your family this holiday season. And the last, with that being said, I want to congratulate my son, who graduated from Coastal Carolina University. You might have heard of them. They're the little team that could, and they're in the top 10 of the AP poll in football. But he graduated with a degree in 2.5 years. I want to credit the King George school system for that, and to understand there's many different ways you can go to college now, and you can even get out in 4 years. And I attended his graduation ceremony, and I'll reach out to the school board. They had really innovative ways to have that graduation ceremony on a football field with over 300 students, and it was really nice to see the kids have the opportunity to be acknowledged and walk across the stage and have their at least 4 family members there to cheer them on. So I just wanted to say congratulations to my son. Now he needs to get a job. But anyway, thank you to all of King George. And as Mr. Bush says, I would like to say goodbye to 2020 because it wasn't as exciting as I thought it would be. So here's to 2021. And I've enjoyed also my time being chair, and I will be passing that along to the next in line. And hopefully it's not as an exciting or as challenging a year as 2020 was. So I will end my board report now. And we will move on to the consent agenda.
I move to accept the consent agenda as presented.
Second.
Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye. Motion carries. County officials report. Constitutional officers. Dr. Young, does anybody?
No report, Madam Chair.
Thank you, Dr. Young. Report from the county attorney. Mr. Britton.
Thank you, Madam Chair. I have two matters. One is a deed of subdivision for Oakwood Estates, Section 3, which I presented. I've reviewed it. Community Development has reviewed it, and it's in order as required by the subdivision ordinance. It requires a vote of the board to accept the deed. And county staff has the original deed ready for your signature at a time that you can make it over to the county offices should you vote to accept the deed. Nothing more.
Thank you.
I move to accept the deed of subdivision for Oakwood Estates, Section 3.
Second.
Any further discussion? All those in favor say aye.
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 Mr. Granger, I didn't know if I heard you there. You said aye?
Aye.
Thank you. Any nays? Chair votes aye. Motion carries. Mr. Brenton?
Madam Chair, I would ask that you consider the advertisement of a public hearing for the renewal or extension of the Bayside Ford land use license agreement renewal. As you may know, Bayside Ford is leasing land from the county next to the county bus garage on 301, and that is coming up for renewal. I have gone ahead and presented an updated lease or land use license, what we're using for that particular piece of property. It's an annual agreement, and it's at the same rate this year and has a 5% escalation clause if it were renewed thereafter. I've updated the agreement to be in accord with state law. It is a disposition of land owned by the county and requires a public hearing.
Move to advertise a public hearing for the Bayside Ford land use license renewal as presented.
Second.
Any further discussion? All those in favor say aye.
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 Chair votes aye. Motion carries. Thank you, Mr. Britton.
Just one thing, Madam Chair, I don't know if you usually do that. Is that just at the discretion of the county administrator, or did you want to set a date? It is a March 1st renewal.
We haven't set our calendar yet, so would that be better to do at the first organizational meeting?
Yeah. No problem.
Okay,
We got
well,
time.
we will make sure we set that at the first organizational meeting.
That's fine. It's just a 2-week, we need 2 weeks.
Okay. Thank you, Mr. Britton.
Thank you.
Dr. Young, do we have any board, commission, agency reports?
Negative, Madam Chair.
Thank you. Next up, we will move down our presentation to Healthy Generation presentation by Ms. Pat Holland. I serve on the Healthy Generations Board. I am very proud to serve on. I really do a lot for our seniors, and I invited Ms. Holland to come and tell our community about Healthy Generations, and I hope she mentions how they've worked in Fredericksburg area with local businesses to serve hot meals to seniors. So, Ms. Holland, the floor is yours.
Thank you, Madam Chair, members of the board. That was the longest walk I've taken since working at home, so I might be a little winded. I hope not. We are Healthy Generations, formerly the Rappahannock Area Agency on Aging. Our mission is to enhance the quality of life for all older citizens. Originally, the Rappahannock Area Agency on Aging, somewhat of a governmental name. So a few years ago, under the guise of the Chamber of Commerce, there was a study done and they came up with the name Healthy Generations. One of the things that we find in our office is that many people call us for advice. So we've got our parents, our grandparents, our children. So Healthy Generations does fit in that we are trying to keep everyone aging as best they can. Healthy Generations is a private nonprofit. We were established in 1976, so we've been here for quite some time. We are governed by a board of directors. Ms. Bender, Ms. Fracey are both on our board of directors. It's one member of either the City Council of Fredericksburg or a Board of Supervisors from each of the counties that we serve, which is Caroline, King George, Stafford, Spotsylvania. There is also a citizen appointee on our Board of Directors. We also have 2 at-large members. One spot is open now, and the chairperson of our advisory council is a board member. So we now have pretty much a full slate. We are being governed by some wonderful, wonderful people, and we are really looking forward to the future and making sure that we are there for everyone. So the Agency on Aging was put in place per the Older Americans Act that was recently reauthorized in 2020. Some of the things that the Older Americans Act deal with is elder abuse. You can see on the slide, this is from AARP. Elder abuse, assisting caregivers with information and respite care, nutrition programs, Title V, or the Senior Community Service Employment Training Program, home and community-based programs, and also those are the homemaker and transportation programs, which I'll speak about in a little while. As far as agency services, people always ask us, well, what do you do? They usually get to us in a crisis when they need information fast. We like to let people know, which is a great opportunity I have tonight, to make people aware of just what the agency does. So one of our services, emergency services, we have really reborn our emergency services program with the COVID in helping people pay their electric bills, stay at home, pay their heat bills. We have paid rent, food, all sorts of different things. So it's basically a financial assistance for people. We have what we call CREA, which is Communication, Referral, Information, and Assistance. All of the phone calls, all of the information that we give out to people falls under that program. We have all sorts of information. Call with a question, we will have an answer. Our home delivered meals program is just that. It is home delivered meals. People who are homebound can't prepare their own meals and have no one to do that in the household. With COVID, everyone over 60 is now considered homebound. So we, as you'll see in the next couple of pages, we have increased our home delivered meals by over 1,700%. Our homemaker program does light housekeeping for frail elderly. Just think, as we get older, you know, our shoulders kind of get a little sore, we have trouble lifting our hands above our heads, vacuuming becomes hard. That program can really keep a person in their home with just a little bit of assistance. Washing clothes, going to the grocery store, keeping their home dust-free for somebody with respiratory trouble. It's an amazing program that has really, really helped people stay out of facilities. Our legal services, we make referrals to the legal aid. Long-term care ombudsman. When you have a loved one or you yourself are in a long-term care facility, whether it be a skilled care facility as Heritage Hall or an assisted living facility, Hartfield, Spring Arbor, Hughes Home, we have our ombudsman who fights for residents' rights in those facilities. That is that person's home. They can do what they do in a home. You do what you do in your home, that is their home. Many, many times staff does not like something that somebody is doing, so we fight for their rights. That is their home, so we are there for them. If you know of anyone that's in a facility, whether temporary for rehab or long-term care, our ombudsman can take care of any issues. Just be a friendly visit to somebody that's in that facility. We have options counseling, which is basically options counseling. Where do I go next? What do I do? I have a house. I can't cut my grass anymore. What are my options? So that in itself is a program that can really save a lot of thought process for people. A lot of really hard decisions can be made with a little bit of information. But it's hard for that person, as we get older, it's hard to take everything in and kind of reduce it to the smallest things, and that's what we'll be glad to help people with. Public information, our senior cafe in King George, we meet at the Park and Rec building when we meet. We're hoping that we have the ability to all get together come spring. But that is socialization. I don't know if you've heard, but isolation and loneliness to a person is the equivalent of smoking 15 cigarettes a day. So just coming out to our senior cafes, and we do provide transportation to people that need it, just coming out to those senior cafes can turn somebody's life around. It can curb depression, it can curb poor nutrition, just many, many things that are taken care of in just those few hours when we get to meet together. Telephone reassurance is a phone call to check on people. If you know somebody that's out there that needs a phone call, please let us know. We'll be glad to just call them up and make sure that they're okay. Senior Cool Care is a program that we provide in the summer months. It is sponsored through Dominion Power, and it provides air conditioners for people that don't have a means to cool their house. Transportation is just that, like I had mentioned, getting to our senior cafes. We also have mobility options, which brings people to doctor's appointments within our service area, which is the Planning District 16. But it also provides transportation for people to social activities or to haircuts or to visit loved ones. So if you're a senior over 60 or you're disabled and you need to get somewhere, our mobility options program can help. Because of the need, it takes about 2 weeks to be able to schedule an appointment. But we tell people, please call. As soon as you know what you want to do, call us, and we will do our best to schedule that appointment. And last but not least on this list is our Virginia Insurance Counseling Assistance Program, for short, VICAP. And what VICAP does, we just got through our busy period with Part D open enrollment, is make sure, one, that people that are new to Medicare know what to do with Medicare, how to make sure that you sign up properly, what it covers. If you have questions about Medicare at any point in time, if you have problems with a bill, our insurance counselors are there to assist. We have gone virtual with our meetings face-to-face on Zoom to make sure that the person's Medicare Part D plan is the right one for them. We have literally taken people an appointment, put their prescriptions into the Medicare.gov program, and we have saved people up to $3,000 a year just by switching to a plan that's better for them. It is, it's really an eye-opener when you sit through an appointment that the person doesn't have the right plan. Years ago, when it came into effect, the Medicare Part D, the plans were cheap and they covered things, and those people paid $8 a month for a premium, and they just stayed with that premium. And now, years later, the premium has gone up, their drugs are maybe not covered. So it really is something that our staff is wonderful at doing and making sure that the person has the right plan that saves them as much money as we possibly can and they get the best coverage. One of the things that is interesting about what we do, and of course it always goes to funding, but the graph shows health. So 10% of your health comes from going to a doctor. Another 10% of your health comes from your genes, and you really can't do anything about that. So that leaves 80%. 80%, the social determinants of health fit into that 80% that's left. As you can see, social and economic factors our senior centers, our transportation, our congregate meals, which is our cafes and meal programs, and the Medicare counseling all helps make your social being much better. Housing, options counseling, our mobility and technology, heating and cooling, that's all part of the physical environment and programs that we have that make sure those parts of a person's life are taken care of. And the healthy behaviors are Meals on Wheels. We don't actually call them Meals on Wheels. We have home delivered meals. Care transitions, which is helping someone transfer from the hospital to a home setting or a facility setting with ease. Personal care, our home and evidence-based programs, which may be a chronic disease self-management program, which we're doing online, to try to make sure that people have the tools to remain healthy. So that 80% can be taken care of by an Agency on Aging program, and we will keep folks in their home safe and happy with dignity as long as we possibly can. That is our goal. Nobody wants to leave their home, and we will try everything within our power to make sure that that happens. The next slide is just a little bit about King George, our home delivered meals, our homemaker program, the number of people that we've served. It's a small in King George. We're trying to get the word out. People are proud in King George and want to help each other instead of asking for help. But we do want King George to know that we are here and we want to be here to help. The next slide is dealing with COVID, and this is what we have done the last fiscal year. But as Ms. Bender said, March really hit us, so a lot of these numbers, they went sky high in March. One of the things that I want to say, and you can look at this yourself, but we had, on March 13th, we had 48 home delivered meals clients throughout the service area. At the height of our delivery of meals, we went to 872 people. That's where that 1,700% increase went. We still are receiving calls from all over the county, all over the service area, asking for meals. The need is still out there. We want people to stay safe, stay in their houses, still have proper nutrition, so we are there to help. We can grocery shop, we can provide transportation, we'll do whatever we can as an agency to make sure that our seniors are safe through this and through anything else that 2020, 2021 can throw at us, no matter what. So what does the future hold for this area, for seniors? It holds a tremendous increase. So we need to be there. We need to be able to adapt our programs to provide caregiver support, to provide respite care, financial services. So we have a lot of growing to do, and we're in a regrowth period, and we are putting everything that we've got into making sure that all the citizens are taken care of. So I do appreciate your time. I hope you've learned a little bit about Healthy Generations. If you ever have any questions, don't ever hesitate to holler at us up the street, and we'll be there. So thank you very much.
Does anybody have any questions? I really thank you for coming. I think I wanted you to come because I wanted people in King George to understand what is Healthy Generations all about and how they could be even more helpful, because I think it's just getting the word out. And I just wanted to ask one specific is, I know in our board meetings, we talked about Fredericksburg and using CARES Act money, and they were able to have some of the restaurants be able to deliver to seniors. And I was hoping some of our King George businesses, though I know probably the CARES Act money is expended, but still be able to give our local small businesses a way to make money and also deliver to seniors that might like a home-cooked meal.
Absolutely. As Ms. Bender said, we've been working with, it kind of all came together by chance. One More Taco, Orofino, Italian Station, Fredericksburg Cupcake, Colonial Tavern, Gulrich's Pharmacy. One More Taco really started it, and they, with the governor's orders back in March, had to shut down, and they had just received a delivery, and they said, what are we going to do? So what it became is One More Taco working with the others to deliver meals to seniors. They call them their elder meals. We, from March through now, we have gone, One More Taco itself has served well over 2,000 meals a month to people. We have paid out probably well over $100,000 in reimbursing those restaurants. So it's really a win-win situation that we were able to enter into. The restaurants feeding the people that needed it, the CARES Act funds from the Agency on Aging helping to keep those restaurants afloat, and we hope that that will be able to continue. If there are restaurants in King George and anywhere else, please contact us. We have a little bit of money left. We don't know what the future brings, and we don't know if there will be any money. So please call us, and we'll see what we can do. We love to partner. We'll do whatever we can to make sure that our seniors get taken care of.
Thank you, Ms. Holland. I appreciate you coming down to King George and giving us.
Take care.
Thank you.
Merry Christmas.
Merry Christmas, too. All right, we will now move on to the page. Action items, Department of Finance FEMA Hazard Mitigation Grant Program. Dr. Young, who's online for us for that?
Okay.
Is that Ms. Cobb?
Can you hear me?
Yes, I can. Go right ahead.
Yes, ma'am. Okay. Me?
We lost you there for a minute.
Good evening, Chair. 2020. I'm on county
Ms. Cobb?
the board.
Ma'am, I think Ms.
Notification
Cobb
of the FEMA number 7.
Ms. Cobb?
Received notification.
Ms. Cobb, can you hear
I'm
us?
sorry.
Sorry, you're cutting in and
Can you hear
out.
me?
Dr. Young?
Yes, Levita, I'll
Chair, me?
carry the action item. Levita, I'll carry the action item. We can't hear you. I think your internet issues.
Go ahead, Dr.
Okay.
Young. Thank you, Ms. Cobb. It's just cutting in and out. Go ahead.
On October 7th, the county received notification of the FEMA Hazard Mitigation Grant in the amount of $2,328,770. The county intends to use the grant to fund the Fairview Beach Riverbank Stabilization Project. The grant is a 75-25% local match. The federal amount provided by the FEMA totals $1,746,578. The state amount provided by the Virginia Department of Emergency Management totals $465,750, and the local match is in the amount of $116,438. The matching local funds will be funded by the approved CIP. As this is a reimbursement grant, the county will need to transfer an additional $1,328,770 from the general fund to the Fairview Beach Riverbank Stabilization Project Fund Code. $1 million has already been funded through the CIP, and this request for the $1.3 million, again, will be reimbursed by FEMA. I'd like to recommend that the board accept and appropriate the FEMA Hazard Mitigation Grant, transfer an additional $1,328,770 from the general fund balance to the Fairview Beach Riverbank Stabilization Project Fund Code.
So moved.
Second.
Any further discussion? All those in favor say aye.
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 Any nays?
Aye.
Chair votes aye. Motion carries. Thank you, Dr. Young. Thank you, Ms. Cobb. Even though we couldn't hear you, thank you very much for being there. Dr. Young, Caroline County request for letter of support.
Thank you, Madam Chair. I know that this was discussed in great detail at the King George County Board of Directors meeting for the Service Authority, but I will give a brief summary. If you will recall, we had a discussion about Caroline County pursuing a project to withdraw water from the Rappahannock River. This project is being pursued to reduce the county's reliance on groundwater reserves to meet their community's drinking water needs. The project will require approval from the Department of Environmental Quality, or DEQ. As such, Caroline is requesting the King George County Board of Supervisors consider writing a letter of support for the project. the King George County Service Authority General Manager, and I have reviewed the project and believe this effort is favorable to King George County. I'd recommend the King George County Board of Supervisors authorize the county administrator to write a letter of support as requested by Caroline County, but I would suggest that letter of support first be reviewed and approved by the county attorney.
And we have discussion. Mr. Bush, I know you've been waiting. Good. Anybody else? Any questions?
So we had a conversation about this after much deliberation during the Service Authority Board of Directors meeting. We decided to again table it, so I don't see why we would move forward with it at this point in time between the concerns that the directors had as well as the legal issues brought to our attention by our counsel. That's all I would say.
And with that being said, I had mentioned in the Service Authority to bring it in 2 meetings, so the second meeting in January because of the holidays, to give enough time so that our staff could get with Caroline County, because there is some issues. It seems to have been something that was done previously before all of us were on the board. And then to also be able to have some documents sent to us, and then we could ask valid questions. But I would like to at least offer Mr. Stonehill, Mr. Granger, Mr. Bush, at least a second to offer any comments, because Ms. Kupka and I had already commented during the Service Authority. Mr. Bush.
So I'll go ahead. Thank you, Madam Chair. So first off, I find it problematic that the Service Authority Board of Directors is setting tone for the executive body of this county. So I understand that the letter of support was requested by Caroline County to King George County, not the Service Authority Board of Directors. Again, I think it's problematic that when you have the body politic on the board of directors. Service Authority is an independent utility, not the executive body of the county. And I understand it has to do with water, and that's the business of the Service Authority. But this has great implications to the county's comprehensive plan, future development, water withdrawals. And when you look at development, regardless if it's developer X or if it's developer Y, and they're going to build a development, you're going to have the same water withdrawals irregardless. That's why our comp plan is so important. And then you have by right development that is pulling from these aquifers as well. I think Caroline is looking to the future. They have a plan. It's been in the works for a long time. I think it's something that we need to go support them on. Now, I do have an issue with some of the legalities of it. So I agree with the tabling. I just don't like the way that it came about. But the question was made about the 11 million gallons, and then there's 3 million gallons, and who gets what. And I definitely want that sorted out, because King George, while they're asking for our support and this would be a joint venture, I want to make sure that it's all in fair play. And then that brings about the biggest thing, is how eventually are we going to pay for this? We've already exhausted the customers of the Service Authority. They simply can't afford to pay anymore with the 5-year plan that was put in place. We still have a line of credit. We've already voted on Perkins Corner, but now we don't know what we're doing with that. It has implications to future economic development. We're looking at a leachette program now to where we can try and diversify our footprint, which I think is great, but all that costs money. And the Service Authority simply does not have the operating capital to do that. The county is not in a position to bail out the Service Authority. We can do things to help them with economic development if that's truly a trend we want to go down, because it doesn't look like we are. But at some point, we need to realize that we can have all these dreams and desires, but we eventually have to pay for it. So I like the letter of support. I'm fine with moving forward with that pending legal review, because I think that the withdrawal amount and who gets what is the most important sticking point. But I do believe we should absolutely support in this venture. Thank you, Madam Chair.
Thank you, Mr. Bush. Mr. Stonehill?
if there are legal issues about it, yes, we need to straighten those out. I would like some more information on this, and, you know, if they had somebody that was in this could come over and give a briefing to us. I mean, I don't think this is the time to go forward with that. I would certainly want more information on this here.
Thank you, Mr. Stonehill. Mr. Granger?
Yes, ma'am. I would say I think Mr. Brooks brought up a lot of good points. I would ask if we table until January, does that have an impact to Caroline in regards to their request? Or are they really running up against a timeline for needing us to provide a letter of support?
Dr. Young, Mr. Britton?
Yes, sir. I don't think that it's time sensitive, and if the board wanted to table the discussion in January, I think that would not put their application in jeopardy.
Okay. In that case, I would be more inclined to say let's table this until January, allow legal counsel to take a look at it, and then, I thought Mr. Stonehill had a good idea about seeing if someone would maybe come and brief the board, just to get more information. But, if it's not time sensitive, then I'd say let's just hold off for the moment and get those questions answered before we make a decision.
Thank you, Mr. Granger. Ms. Kupka, did you want to say anything else? Same for myself. I really want to get more information. I think this was a matter that a previous board, looked at, and we just need to have more information. And I appreciate our staff for going out to get it for us. So Dr. Young, we'll do the same thing as we said in previous. We'll table it to the second meeting in January to give our staff time to get more information and legal review.
Roger, ma'am.
All right, after we table that, we'll go discussion items, Fred feasibility study. Mr. Minor?
Good evening, Madam Chair and members of the board. I'm here to facilitate a discussion on the Fred Transit feasibility study. The Virginia Department of Transportation allocated $45,000 to the George Washington Regional Commission to commission rural transportation studies for fiscal year 2020-21. Working with GWRC staff, the Economic Development and Tourism Department recommended the 3 study topics listed below. Feasibility of reinstating the Fredericksburg Regional Transit Service to assist with initial planning, GIS support, and data analysis of potential bus routes in the county in coordination with FRED. Deliverables: support communication with FRED and a baseline study to determine the feasibility of service in King George County. Number 2, King George Industrial Park. GWRC staff will work with county staff to develop a foundational plan for utilizing EDA-owned land in the King George Industrial Park. This study effort will explore the possibility of developing a commuter train station along the existing rail line. Deliverables: coordination of meetings with stakeholders to support this effort, study report and presentation to King George County staff and GWRC. Number 3, commuter bike path along Doggin Railroad Heritage Trail to assist with the planning, GIS support, and initial data analysis for the project. With this analysis, county staff and stakeholders will have information to make decisions around possibilities for the trail in the coming years. Additionally, GWRC staff will assist with identifying potential funding sources. Deliverables: study report and presentation to King George County staff and GWRC. The Department of Economic Development and Tourism recommends that King George County continues with the feasibility study of reinstating the Fredericksburg Regional Transit Service and commuter bike path along the Doggin Railroad Heritage Trail. I'm here to answer any questions and to carry along the discussion.
May I ask some questions? Mr. Stonehill?
Not really a question, but I would certainly like to get Fred to get back here. I know that's something that a lot of people have asked about, and we seem to have missed out on quite a bit of that, so that's all.
Ms.
Thank you, sir.
Kupka?
So can you explain to me, how is this different than what I worked on for most of the year in 2018 as a staff member, quite frankly? FAMPO did a study, and I believe I provided you with a copy of it, of the feasibility of commuter service. I attended monthly meetings, some in person, some were calls. I helped FAMPO, and I think it was called Foursquare or something like that there. They hired out an expert. We mapped all the routes. I don't understand what the difference is with this compared to what was done 2 years ago that my understanding is never went anywhere and never was presented to the Board of Supervisors. So how much more work really needs to be done? This doesn't seem to me like it should be a very heavy lift other than updating cost estimates, but it was a very lengthy PowerPoint presentation and report that was done 2 years ago.
Ma'am, I apologize. I don't remember you passing along that study to me. You probably did. I just don't remember it. I do know that we did have a conversation about there being some sort of application submitted to maybe Smart Scale, that there may be potential to put in some Fred Transit stops within the county. I do remember that discussion with you, but I don't remember a study being completed 2 years ago. So I apologize.
So I can email it to you. I believe I gave it to you in an envelope in person in your office when we had a discussion about the possibility of looking into this again, trying to revitalize the conversation about it. And so I absolutely appreciate you bringing this here tonight. But frankly, a lot of this work was already done, and I think really just needs to be updated as far as the costs go. And then it can be brought back here for everyone, for all of us to have an educated discussion about it. And I do realize that, I guess the concerns at the time were, if only like 6 people use it, you could give those 6 people a car for what it would cost to operate it. But there are some grant opportunities out there. So I would like us to take a look at it again, please. Thanks for bringing it to us.
Yep, absolutely.
Mr. Bush?
Thank you, Madam Chair. Thank you, Nick, for coming out here tonight. Frankly, I'm not a fan of Red. I know the county participated years ago, dumped a lot of money into it. It simply wasn't utilized. I think it was a bad investment, and we should learn our lesson from it and maybe look at alternate means. But the cost, I just don't see the return on investment to taxpayers. So unless I could be proven otherwise, I just simply don't support the initiative. Thank you.
Mr. Granger?
Thank you, sir.
Nick, thanks for coming out and providing the information. I don't have any other questions at this time, though.
I have one question. With this study, will this cost, if we agree to this, is this going to cost us any more money?
Ma'am, it appears that they're going to utilize that grant money that's set aside from VDOT to do it. I don't know exactly what the cost is. I didn't get any type of estimates or anything about the time they're going to put in and what they're going to charge for it. So,
but would this cost? Do you know the answer? Would this cost? Is there a matching fund from the locality? That's my question.
No, I don't think so. I think this money is allocated directly from VDOT in support of rural transportation studies.
Ms. Kupka?
Madam Chair, I'm not positive because I don't have the GWRC website pulled up, but I'm fairly certain that in the budget, we did adopt this as part of the rural work plan, and there was a budget included, and I do recall one of the items being this feasibility of the Fred service and the commuter bike path, I believe, for the Dahlgren Trail. I don't recall seeing that there was any locality match involved at the time.
Right. I just wanted to clarify it for the public so that people might ask, are we paying for another study for something that might not be possible? So it is being paid for by that grant, but just to clarify that. So what do you exactly need from us? You just need a consensus?
Yes, ma'am. So the topics, so I'm only recommending the 2. However, if this study does exist, Ms. Cupp, I'm not trying to say it doesn't exist. I'm just saying if there is a study that's already been completed, then I say we just work off of that study. It's not a reason to request another one. So I would like to move forward with just a commuter bike path along the Dahlgren Railroad Heritage Trail. If there's no need for the second feasibility study, I think maybe we could potentially come up with maybe an additional topic, unless it has to go back to the GWRC board to be approved or the PAMPO board to be approved.
Well, I do know, talking with the executive director from GWRC the last 2 days, she had said there's an initiative, especially from Fred and the new FAMPO director, of trying to reintroduce Fred into Caroline and King George. So I know they were interested in that part of it. So what do my colleagues feel about supporting at least just 3, understanding that it's not coming out of, all 3 out of King George's pocketbook?
I feel like we still need to keep number 1 there, just in case there is an update. I mean, it has been 2 years. The economy has drastically changed, with the impact of COVID. It might be that they come back and say, hey, it's not worth it now because, people don't want to use mass transit because of it, So maybe they'll come back with a recommendation that, hey, maybe y'all need to delay this a few more years and look at it again. I don't know. So I don't want to rule it out. I think we should go ahead and keep it in there, especially because I do believe that GWRC has already obligated itself to that.
Yes, ma'am.
So what is our recommendation?
I would go with Mr. Minor's recommendation to continue with the feasibility study of reinstating the Fredericksburg Regional Transit Service and commuter bike path along the Dahlgren Railroad Heritage Trail.
Okay. Do you need a motion or just a consensus?
Just a consensus, ma'am.
All right. Do we have a consensus for that, for number 1 and number 3? You can say no if you don't want to. Yep, there you. So we have Mr. Granger, give your 50 cents in.
I'll be brief. Yeah, I give consensus.
All right. Thank you, Mr. Minor.
Thank you, ma'am. Thank you, board.
Next up on our agenda is the King George County Schools CARES Act funding. Dr. Young.
Thank you, Madam Chair. We have received the school's audit as requested. I have reviewed the report with Dr. Benson, the finance directors for both the county and the schools, and the county attorney. We believe the purchases are legal and are in compliance with Treasury guidelines. In addition, I confirm the schools are in possession supporting documentation for the expenditures. I recommend the King George County Board of Supervisors authorize the payment of the school's CARES Act expenditures in the amount of $976,969.85.
Right, Dr. Young, just to clarify, Mr. Britton is online still. We have Dr. Benson online?
That's correct. Yes, ma'am.
Thank you. I know all of my colleagues, we have a printout of our audit and the original request that was in August, and then a constituent's concerns concerning the information on the audit. I know I have quite a few questions, but I'm going to go down the line and ask each of my colleagues. I'm going to pick Mr. Granger first because he is online. Mr. Granger.
Yes, ma'am. Dr. Benson, I thank you for being here to answer our questions. I had a handful of questions. I was kind of curious about a couple things. I looked at the public-facing plexiglass line item. We had a request for about $5,000, but it came to the tune of about $55,000, which was a pretty significant increase. While I know the overall expenditures of the schools was less, I was just curious as to why that was, because that seems like a pretty significant underrepresentation of the expectation.
You're correct. It's a good question, and I can let you know that after we or subsequent to the joint meeting we had, you're aware that we pursued a K-2 reopening. Went to the survey sent to families, we determined that we would have a percentage of students wanting to return in person that would not allow us to distance at a distance of 6 feet. And so we looked to plexiglass options to try to help mitigate the fact that we would need to utilize 3 feet with a mask as the distancing standard. And so we felt it prudent then to look for, and of course, at this time, finding plexiglass and finding the desks, so like finding wood in a hurricane to cover windows. It was a rare or a short supply. So anyway, we jumped to the opportunity when we had the chance to order and receive in time for what would have been that opening for K-1-2 with the plexiglass. All that to say is that the guidelines or the requests that were submitted at the time we met jointly, subsequent to that, we did have some needs that emerged as after the fact, so to speak, and we tried to make the adjustment accordingly.
Okay. I also noticed, do you have again, I know that you came in under budget overall for the total request, but the psychological services, your group had estimated about 80K and it only cost about 15K. Was it just a misunderstanding of the amount of services you would need?
I think so. Ms. Bush, our special ed supervisor, made the initial estimate, and I checked back with her, but more than sufficient to cover the cost that she had in procuring the help for those special ed services, the psych services in that case. And given it was also a relative to the full school year, it's a relatively short amount of time we had. And I'm sure that there's a great stressor on the contracted services we were looking to utilize in terms of those psych services.
Okay.
But at any rate, we didn't, obviously we wouldn't spend it if we didn't need to.
Understood. I was just curious was all. Looking through the nurse substitutes for return to in-person. So the line item at least showed in the notes, nurse support to respond to COVID concerns, isolation room, and typical nurse needs. 6 clinics times 8 hours times 20 hours, $20 an hour equals $960 a day times 9 weeks remaining in the fall semester, which was, I'm assuming, for back to in-person schooling. And so obviously we're not back to in-person schooling. I'm kind of curious about.
Not necessarily. I mean, the expenses there. Well, I'm sorry. The technology issue on my end. I'm sorry.
It's okay.
I missed the second half of your question, Mr. Ranger. I apologize.
It was really just looking at the nurse substitutes for return to in-person. And I do know we have some students that are back. I see that there's line items that are showing expenditures back in August before any kids were back in school. I see some that looks like they're to employees that are currently school employees at the time. So I was a little confused why nurse substitutes for a return to in-person line item had money going to current King George County school employees if they're not nurse substitutes. That was a little weird to me. And there was also a number of items in here that look like they're purchases of materials, which, I know that there were a number of requests for those kinds of things. It just seemed odd that they showed up under this line item as opposed to under that other line item. And I didn't know if you had an explanation for that.
Again, I would say when we prepared this request, we didn't really view the descriptors necessarily as line items. We were the types of expenditures that would certainly support the schools and the type of funding that was at hand. So I think there's a little bit. I spoke with another supervisor today by phone over the very same issue. And so the descriptor out to that you read, the isolation room and the needs that those rooms and our clinics still have, and at that time we anticipated would need. Those were listed and I just general the types of needs that to devise to help support. So the isolation room is obviously a new mitigation strategy that we've not hosted before. So to equip such rooms and to equip the nurse stations in the schools adequately, those are the types of expenditures under there that you're referencing. And so if that was a misunderstanding, that we were not simply requests, but that these are going to be adopted funding appropriated according to these line items, I was not under that impression. And so that would be just miscommunication, at least part there in terms of the initial appropriation. I hope the HEPA, the trash cans, those rooms in our school.
Dr. Benson, I'm having a hard time hearing you. I don't know if other people are. Maybe it's my connection, but can anyone corroborate that for me? I apologize.
Dr. Benson, I'm going to try to, go ahead, Dr. Benson.
No, I'm sorry. I could hear Mr. Grange. I couldn't hear anybody else.
Can you hear me, Dr. Benson?
I can hear you just fine.
I think Mr. Granger is asking, he wasn't able to hear all of what you said. And Mr. Granger and Dr. Benson, please correct me if I'm correct, is what, for the nurse substitutes, what you were saying is there were some unforeseen needs that have arisen that whether the students are in session or not, you were preparing for the students in session and you did not understand that it was so specific. Is that correct?
Yeah, I don't necessarily, this category that we're speaking about, were unforeseen. Certainly the plexiglass, that was an adjustment we made, given the K2 number for families, families that were looking to move to in-person. And that's why we chose to scarf up the plexiglass to help add another mitigating factor to those classrooms. But in this particular section of the request, I believe there were unforeseen needs, but we did needs for the rooms and for the nursing rooms heading, I guess. And I do see confusion because the bolded language to the left doesn't necessarily wouldn't lead you to include all of the aspects of the description to the right.
Well, Mr. Bush has a question for you concerning this, but I'm looking at the original request that you sent to us and the board had, the school board also had, and under nurse substitutes for return in person, it specifically has an amount, and then it says nurse support to respond to COVID concerns, isolation room, and typical nurse needs 6 clinics times 8 hours times 20 hours equals $960 a day times 9 weeks remaining in the fall semester. So I have a problem with that because if the kids aren't in school, where are the nurses? But I know, Mr. Bush, you have a question on that.
Thank you, Madam Chair. So, Dr. Benson, thank you for being here this evening. So I was looking at the minutes from the meeting previously. Some things I heard tonight was unforeseen. The Board of Supervisors in that joint meeting made it very clear that we were approving the CARES Act funding request line by line. So they were to fit in a certain perimeter. So it's basically, I would look at it as misappropriation by using funds for something that was not the initial intent or the authorization to utilize those funds for. That being said, I'm going to revert back to the meeting. This is going to be, I'm going to try and read this. This is comments from Ms. Kathy Bender during the joint work session. Ms. Kupka highlighted this a little bit. The nurse substitutes for return in person. So that money wouldn't be utilized if, say, you didn't go back October 15th. I mean, you get $32,000, but this is that for a short amount of time, from October 15th to December 30th, or is that from now? Response from Dr. Benson. That would be estimated for the year. Should we return in the middle of October? There was no return in October. And then this audit was requested in writing on November 4th. We didn't get a response till the week after the board had to take action to follow up on the status of the audit. I understand that things pop up, but I also understand this was not the only source of funding that the school board had for CARES Act, and that other funds were utilized for other things. But being this was a line-by-line request authorized by the Board of Supervisors, there are some things I would be willing to give flexibility on. However, the nurse substitutes, I believe every item in that line is not with the intent of what it was sold as during that joint work session. It was basically sold as, this is what we need to be able to return to in-person school back in October. The school board took its own independent direction, which it's their right to, and they didn't. Therefore, the funds were granted under false pretenses in my understanding, and I would like to fund the school board's CARES Act request for CARES Act expenditures minus the line item and category of nurse substitutes for a return to in-person school.
Thank you, Mr. Bush. I want to go back to Mr. Granger. Did you have any?
Yes, ma'am. I would, so when I look at the nurse substitutes, the line items, I see a handful where it's just a name and a date for the expenditure. What does that mean exactly, Dr. Benson?
I assume that would be the submission date or the reference for our the entry into the payroll system for that amount is all that is. But the persons that are listed there, you are correct. We do have some students in the schools, and we do need nurse support presently. That you see there are working whenever we have an exposure or we do contact tracing based on a positive case that's made known to us. Those people are working beyond their contracted hours to do that, to help with the contact tracing and the coordination with the VDH to make the proper referrals and follow up and response. Okay. I don't want you to leave thinking that these, go ahead, I'm sorry.
That was really what I was looking for to better understand. It was just, some of them were current employees, and I was trying to understand how current employees in the school system were showing up on here for substitutes. It was just an odd look to me. And so that helps to explain to me the fact that they're putting time beyond. That makes sense to me, at least. So, thank you.
You're welcome.
Mr. Granger, did you have any other questions?
If I might, if you want to move on, I'll go back through my sheet and see if there's anything else that comes to my head. I don't want to hold us up though while I continue to look through. I had some notes, which I got the ones I was thinking about, but I just want to make sure I don't miss something. So if you don't mind circling back to me at the end, I would appreciate just to verify.
I will circle back. Ms. Kupka?
Thank you, Madam Chair. So I would just say, Dr. Benson, where it has staff members' name and their current staff members, realizing that the line item was called nurse substitutes for return in person, but the extended explanation was nurse support to respond to COVID concerns. That's not extra money or overtime or stipend or anything. That's the portion of that regular employee's salary for their time that was dedicated to addressing COVID concerns that can be claimed under CARES Act funding. Am I correct in that?
I'm suggesting that this funding is supplanting part of their regular hours, and I don't know that to be the case. If I'm understanding you correctly, I'd have to go back and do more homework on that to answer your question fully. I just don't want to guess that that's correct.
I understand. So a similar example would be when we had our Parks and Recreation employees, I believe, spend their time doing something different, doing work that is substantially different than their normal job description, which for some of these people, yeah. When we implemented the virtual learning centers, we could take a portion of their time or the dollar amount that they were paid for that time and apply it towards the CARES Act funding because their job had changed because of COVID. I think that's the bigger question I'm asking here.
I can check on that. I don't tell you the correct answer or guess here tonight, but I do know that many of these employees are working weekends. You know, it's not, I remember back we had a couple reported to us on, say, a Saturday. And so we spent the day Saturday and then Sunday responding, conducting the interviews with the two positive, checking the hospital's contacts, and then to notify as well as the school employees, that type of thing, over the weekend. So that's why I'm hesitant to say that this is simply a reflection of time spent doing something other than their customary job responsibility set.
Okay, I think I would have felt better if you could have, so I'll leave that at that.
Yeah, tomorrow I can find the answer to that question though, Ms. Kopka.
Thank you.
Dr. Bench, we're asking you these questions too, and Mr. Bush, I'll get right to you, because there's a lot of line items here that have people's names and or Amazon, and I've had constituents reach out to me and say that have seen what they could see online with this audit. What is that about? And so this is transparency because people are already upset that schools aren't open. This is just giving them one more arrow in their quiver. So we do have quite a few other questions here. And I mean, one of mine I'm going to come to is all these Amazons, and there's no explanation for it. But Mr. Bush?
Thank you, Madam Chair. And I thought I was done, but I want to follow up on something that Ms. Kupka brought up. So it looks as though these aren't additional stipends or bonuses or anything of that nature, that this is supplanting employee salary. Now, I believe Mr. Britton is still on the line, but I think legally the only salaries that we could supplant would have been public safety, and education does not fall under public safety. That's only fire, sheriff's office, and service authority employees. So I'm wondering, is the supplanting, I mean, even though we gave this to the school division, it's still utilizing CARES Act funding, which is the source for supplanting salaries or portions of salaries, billable hours of schools employees. Does that wash out? Is that a legal utilization of the CARES Act funding as we know it?
Well, that was my point exactly, Mr. Bush, and that's why I was hesitant to answer Ms. Kupka's question, the affirmative, and that I do not believe those amounts are supplanted, as you're suggesting. In other words, funds that have just been drawn against CARES instead of their regular salary line. Those, in fact, may be for compensation for hours that they dedicated beyond their contracted hours. So I appreciate you clarifying that, because that's exactly the reason why.
Okay.
I didn't say that those amounts are a supplanting of the general salary.
Gotcha. So this is something I would like Mr. Britton to look closely at, only because if this was a bonus or stipend or overtime, whatever category that would fit in, being its CARES Act funding, ultimately, this is the audit that the schools provided to the county for the county allocated CARES Act funding. Then the county is going to have to basically face an audit from the state to show how we justifiably utilized all this funding. If this isn't something that washes out, the county is on the hook to pay this back to the state. And we're not in a position where we can absorb a lot of cost. That's why I want this one looked at as closely as possible. Matt, if you can hear me, if that's something you can look into, I'd appreciate it.
We can certainly look into it. I just don't know about the time factor because you have as I understand it, you have a motion tonight to pay the expenditures that are bona fide expenditures under both CARES Act federal law as through the state to us, and then as the school board as a subgrantee. You are, the way Mr. Bush stated it, is correct. I'm not sure how the schools can use their funding, but for county funding, which is then given to another political subdivision or agency of the county as a subgrantee, we have to follow the General CARES Act regulation, which says that only public safety employees, which does include, as Mr. Bush said, utilities, can have that applied to their salaries or hazard pay in lieu of their normal salaries. But the issue, I think, Madam Chair and Mr. Bush, tonight is that the motion is going to be to pay certain expenditures, and I assume there'll be a motion to remit the remainder of the original sub-grant to the schools back to the county as not expended by December 1st, or as not allowed under the categorical sub-grants to the schools, and then to apply that as county administrator sees fit under CARES Act guidance. So I don't know that there's much that would result from a financial or forensic or legal review because you don't meet again.
Okay,
Madam Chair, if I may weigh in?
Go ahead.
The answer is yes. The CARES funding guidelines does provide for CARES funding to be used, not as a bonus, but basically as a reimbursement mechanism to the county, or in this case, the schools, for budgeted personnel and services who are diverted to a substantially different use. So if the schools had in their budget, an individual was going to serve as an administrative assistant, but COVID forced that individual to act outside of his or her job and duty description to perform another job or duty description, then it is a legal expenditure against CARES funding. And Mr. Pepper is absolutely correct. We actually did utilize a portion of CARES funding to reimburse county employees, for example, like Parks and Recreation, where we actually sent Parks and Recreation employees to the convenience centers to work because programs that got shut down.
Ms. Cupcake.
And Madam Chair, all I'm suggesting is that doing that analysis, if Dr. Benson were to get you that information tomorrow and we reviewed it, let's say that was the case, that these were as a result of COVID-19 and therefore acceptable expenditures as opposed to as a result of paying a portion of a salary for a non-eligible employee, what consequence would that be? Because the board doesn't meet again.
Ms. Cupcake.
So, Dr. Benson, are you still there?
I am.
Sir, did you say some of these nurses and Mrs. Fisher were used for contact tracing?
Correct.
So if you look at page 4 of the most that I could find, the October guide, frequently asked questions, coronavirus relief fund on the treasury.gov website, page 4, number 16, are expenses associated with contact tracing eligible? Yes, expenses associated with contact tracing are eligible.
Dr. Benson?
Yes, I agree. I mean, I'm listening to Ms. Kopka's reference there. And so that seems to support that the expenditure, and I'm just about 99% positive that these are not amounts that were charged as salary. In other words, we didn't use these as substitutes for salary. These are hours above and beyond done for contact tracing, for training, training development, that type of thing related to COVID. So I appreciate Mr. Bush's point and agree. There was no supplanting of salaries. This would have been compensation afforded beyond their salary for duties done beyond their customary work hours.
Mr. Stonehill, you haven't gotten to go yet.
You all pretty much hit on everything. There's a lot of gaps in here, and I know in my very small little business, if I had these line items and nothing really associated with them, my accountant wouldn't be very happy come spring. It seems like a lot of it's just, the nurses, for return to person, school, they're not back in school, but I think you all have pretty much covered it. There just seems to be lots of gaps in this paperwork. That's all right now.
Could I follow up to that? Because I do want to note that this was a listing of expenses. There are, as Dr. Young mentioned in his opening statement, there are certainly invoices, and there is another level that can be referenced. And of course, you understand that all of the finance paperwork, the entry into the system flows through the county office, and it's been that way for many years. So it's all referenced. It can be referenced at a more discrete level if you choose to through the actual invoices and that type of thing. So while this is a summary of expenses, again, the actual invoices, the POs, those types of things can be referenced through the county system. I'd say that in response to, I think Ms. Bender, you said there's a lot of Amazon listings. And while that's the reference on this document, it can certainly be traced down to the actual items and those types of things, if you would choose to have that information.
Ms. Kupka has a question, but something you just said bothers me. And it was like, you can go look. It shouldn't be our job to look. When we ask for an audit, we should be provided the information upon questioning. So that's just one of my little sticklers. But another thing I have some heartburn on is the date for these purchases were supposed to be November 30th was the end date. I see a lot of 12/11. That's way after 11/30. I also see 11/20, 11/13, and just Amazon reference. And my problem with that is we asked for this audit at the beginning of November, November 4th, and it just seemed like there was a purchasing fest to get to that November 30th, and the money that we had our board meeting in August to approve these. And so this gives me some heartburn. And I know when it comes budget time again, I'm going to be asking for a lot more information because I have a lot of heartburn. I probably need a Tums right now. Ms. Kupka.
I may be able to help you a little bit. It's not the date, and I remember speaking with Dr. Young to clarify this too. When you see 12/11 or you see an end of November, that's the date that the payment was then posted to the system. In other words, when we received the invoice or anticipated receiving the invoice, it was not the date of the purchase, if that's what you're thinking. So there may be some administrative assumptions being read into this that simply don't hold true. I do know that we had that conversation, Dr. Young, that because the very same question came up when we saw dates beyond December 1st on this. And that was simply Ms. Williams had placed, on our side, had placed then the date that the actual invoice then would be paid, not when the purchase was initiated. I hope that helps clarify that.
Thank you for clarifying that. Just maybe in the future, the spreadsheet to show when it was ordered and then paid, just so we don't, because I'm just going for somebody in the public that might FOIA this or has read it online, they're going to read that and have a heart attack or maybe a small coronary because they see those dates and that clarifying information isn't there. So that might be some food for thought for the future. Ms. Kupka?
No, I absolutely agree. Absolutely agree. And I will say that, this was new. We've never had this type of funding. We're in a very unique situation. Certainly, in hindsight, we would have developed the request or structured this in a way that didn't leave this type of confusion. I think there was even confusion about what an audit represented. So, I apologize for any miscommunication or misunderstanding. Certainly in the future, then perhaps we can structure this more closely and structure it in a way that then we can provide the information on the back end in a way that it's expected. So obviously there were some customer requirements that weren't met in terms of the communication of this and the formatting. And I apologize, the wording around this in particular, I think that in hindsight, we would have tried to offer them in a more inclusive way, trying better to anticipate the breadth of need that could have revealed and which ultimately did reveal itself through the first semester to prepare for person learning. So my apologies for that. I do hope, and we tried to absolutely everything, all the purchase we made, we believed were within the spirit of the funding and the purpose for the funding to support the schools. And so I'll leave it at that. Answer any remaining questions you have.
Thank you, Dr. Benson, for that. Ms. Kupka?
Thank you, Madam Chair. So I too, I believe what was purchased is within the guidelines, the CARES Act guidelines. However, I would be remiss and frankly, I would be irresponsible in my duties if I didn't make you very aware of the concerns I have with some of the optics on the timing of some of the purchases. I would like to look at disposable gloves. The line item amount was for $10,500. And so just so you're aware and the public is aware, for every one of these categories, I added it up myself and ran the delta, whether it was plus or minus and what amount over what was requested in the original request. So $10,500. And I totaled it and got $15,160.59 were spent on gloves. So why I'm questioning this is 15,000 minus about 5,000, the $4,997.75 in December, which I realize is probably something bought November 30th because it was, the warrant was paid out on Friday, December 11th, if I know how the warrants work around here. You already had purchased $10,000 worth of gloves as of November 13th. So if you've already spent your $10,000 worth of gloves as of November 13th, why in December, when it's coming up on the deadline, are we purchasing another $5,000 worth of gloves? My concern is that on the line item level, I don't see where there was a lot of discernment as far as, okay, out of this line item, how much have we already spent? Was that actually tracked as you went along? Because I have a great deal of concern about that because it sort of looks to me like it wasn't. And then I can give you another example of that. The next one, disposable gowns, $2,475. And so as of October-ish, you'd already spent almost $2,000 of that. And then in December, there's another $4,961. So you're over, you already know you're within a couple $100 of what the line item was for, but we're busting out big purchases at the end of November. That happens again with disinfecting wipes. The line item was for $4,875. the total I got when I added the expenditures up was $11,865, and $9,000 of that happened, in November, that gets paid out in last Friday's warrants. So for me, I just feel like I really have to ask, was someone doing a running tally of these expenses, and did anybody use some judgment and say, hold on a second, we're really close to what the line item said for that? And then was there any judgment as far as, okay, we're getting close, or we're right at what we said we would spend on that? We do know, and I appreciate that there are many other categories where you were under, especially some of the big ones. Like the SPED, I think I saw a delta of negative $65,000. But where or when do we exercise the judgment where we come back, where we have a conversation, whether it's you and our administrator or your board and us, and we say, hey, we're not really going to be able to spend this money in this amount of time. Would you mind if we had an alternate, if we amend our spend plan? Or I just feel like now, rather than ask for permission, you're begging for forgiveness. And I feel like this never should have played out this way. And that's the biggest concern that I have about what was presented here. And I know I just threw a lot at you, but that's kind of the one pattern that I've seen in a couple of these bigger categories that really gives me a lot of concern. That and the fact that the timing of it, you did buy some stuff up front, and we thought school was going to open in October, and it didn't. And then there's some spending. And then we thought school was going to open in November, and it didn't. And then there's some more spending. And then we get to December 1st, where you have to report back, and we claw back, and there's more spending right before that. So the optics on this, for me, just look like the spending overall wasn't properly managed.
Well, I can promise you that we've monitored several different funding sources, not just county cares, but there have been different grants. There have been school cares. There have been CRF funding that we've tried to utilize all of it in the spirit of trying to support the schools, what we're currently doing and what we anticipate doing when, in fact, we do resume in-person learning. So your point's well taken. And I'd reiterate that I think in the future, we'll certainly know that we have headings, and then we have line items in the spreadsheet that was created. In administering the funding that was afforded, I've done my best to administer it in a way that addresses needs. If that methodology is in dissonance with the expectation of the Board of Supervisors, then you have my apology, and I certainly will in the future be more exact in terms of create an actual budget rather than simply a request, much like our operating budget, that then we can track line by line in that instance. I would offer this: if you're looking to nullify, or not nullify, but approve an amount less than the expenditures indicate, knowing that this funding currently is time sensitive, would it not make more sense then to reduce the local effort on the operating budget in an amount equal to that which you would be looking to not approve? Therefore, you have greater flexibility in terms of the timeliness of those funds.
I understand what you're saying, Dr. Benson, and I'll let my colleagues speak on this, but as someone who signed the documents for the CARES Act and understanding that it could be audited by the federal government and the state government, and they could go line by line, that doesn't really work, because when they come a-calling, they're going to come for the money from us, because it was our money, it was our CARES Act allocation, and it wasn't the school board's budget, it was the CARES Act funding, so they would take it from the county budget. I don't know how we could then take it from the school's budgeted amount. It just, yeah.
Oh, I'm understanding that the expenses themselves are appropriate and are aligned with the intent of the CARES Act. I'm simply trying to avoid or brainstorm a way to give you greater flexibility in terms of the December 31st deadline.
Okay. I'm going to have Mr. Britton address it and my colleagues also address it. But I know this is a trying time. It's a lot of new information. We're all coming at this because we've heard from quite a few constituents. It's taxpayer money. Sometimes people get very confused and think we're the school board also. And there are a lot of people are hurting, so they're really looking at dollars and cents. And when you have a lot of these entries, like Ms. Kupka highlighted, all my colleagues highlighted, and I highlighted, and you just have people's names or Amazon, people really start to question. So, I mean, especially in times like now, you need to have more information. I'll let my colleagues go once again. I want to ask Mr. Granger, did you have any more questions? You asked me to come back to you.
Yes, ma'am. I appreciate you coming back as well. I think I know the answer, but I'm going to ask Dr. Benson just for verification. I saw there were 2 line items that have a date of December 18th, which is 3 days from now. And I was just wondering if you could speak to that.
Again, that's a date that is anticipated. Then the invoice will be received and then posted to the system, the financial system. So those dates are not dates of purchase. Those are dates of the processing of the payment.
That was my assumption. I just wanted to verify it, so I appreciate that. I guess the only other thing I would say, my understanding, legal counsel has reviewed this, is my understanding, and my understanding is that the expenditures are legal from a CARES Act expenditure perspective. And so our board, as Mr. Bush brought up, did provide funding on a per line item. And so that my understanding is it would be our discretion on how to then handle the situation, since some of them went over budget. But I don't think there's a concern, and I'm sure Mr. Britton will weigh in shortly. I don't think there's a concern from the perspective of some of these funds being misexpensed from a CARES Act perspective. So that would be just something I would share with the rest of the board. But I don't want to put words in Mr. Britton's mouth. I'll let him speak to that. And that's all I have.
Mr. Britton.
Madam Chair, Mr. Granger, with the exception of what's been brought up tonight, I think Dr. Benson said he was 99% sure that the salaries of the nurses were not being paid. So let's just say a nurse makes $10,000 a year, and that was already budgeted. And this is in addition to that as a result of whether it be Section 16 under the October guidance, Treasury guidance, or otherwise, some eligible CARES Act expenditure. That's correct. What Mr. Granger said is correct. The expenses, as a matter of federal law, with the potential exception of the nurses being paid, or some people being paid, as we just said, to do their normal salary. With the exception of that, they would fall under the federal guidelines as I reviewed them with the finance department of the school board, our finance department, and Dr. Young. The discretion of the board is that it was categorically, as I think Mr. Bush went through one of the categories verbatim from the transcript, it was categorically given. So the question then becomes whether or not the board wants to take action and say, you busted the category, we're not going to pay for those. But that wouldn't be as a matter of federal CARES Act auditing. That wouldn't be the concern. I might note that, and I think Dr. Young will be able to say this, there is some movement among categories because these are estimates. I understand there are large deviations in a lot of these categories, but with respect to a legal perspective on an audit, all of these expenditures are going to fall under the CARES Act guidelines.
Thank you, Mr.
We
Britton.
did also, I might note, ask the specific question, or I did, of the finance person at the school board. Do any of these expenditures in any way pay for services or goods that extend past the December 30th guideline, such as if you bought a MiFi hotspot and then you bought a year's service contract with it, is it only paying for expenses through December 30th? And she told us yes, that they carefully parsed out any of the expenses beyond December the 30th, and that if there were such service contracts, installation contracts, and the like, that those were paid for by other school board funds, not the county funds. I did not see the backup document on that, but I did ask that question, and I believe that our finance and Dr. Young have the receipts and documents corroborating that.
Thank you, Mr.
Ms.
Britton.
Binder,
Yes, go ahead, Mr. Granger.
I apologize. At least my recommendation at the very least would be to ask that we review the expenditures of staff hours to verify that none of them were for just paying salaries, for regular salaries. If it's above and beyond, as Dr. Benson, I think he said he was 99% sure, then that's fine. But if it's not, and it turns out there were any dollars that were spent that were covering just regular salaries, I think we would have to return those dollars to the county, and then either we would have to expend them or return them back. Because I can't in good faith say we would ever allow to do that if it's not legal. So I'd like to do that verification though, and then if assuming that everything's okay, then everything's okay, and if it's not, then we would have to take those dollars back.
I'm certain that those amounts are above and beyond. I would just like the opportunity. That was my way of saying I'd like the opportunity just to confirm it.
And that's fine. I just would like, whatever motion we make, at the very least, to address that one concern in the motion, so that we can say, hey, if there are any dollars that we look to that were maybe misspent, that we would then take those back, and it is what it is at the very least.
I'm going to ask my two colleagues that have another question. Mr. Bush.
Thank you, Madam Chair. So I understand what Mr. Granger's saying, but I'm looking at the entire category. I think we need to move forward tonight in getting these funds to the schools so they can balance their books. And that's why I'm just looking at not funding the entire block for nurse substitutes for a return to in-person. And I want to poke at three things, line items in there. So I heard from a lot of my constituents when the Honeywell air purification system was voted on by the school board at the tune of $750,000. There's two line items in here under substitute nurses for in-person return to school and I'm getting old, I can't see, $4,000 something for HIPAA air filters. But yet we're paying $750,000 for Honeywell to install a new system. Then there's $5,151.60 for some conicide wipes, but that's cleaning materials, which has its own separate line item on here. So the one thing, when I received this audit, I went through it. I called my colleague on the school board. We talk. He hasn't seen it. He still has not seen a copy of this audit. I had a constituent who lives in my district email all of us a copy of the audit with her own notes, and she said she had to request it from Dr. Young that the schools didn't have a copy of the audit. I bring this up because if this is in fact additional compensation for these employees, if it's additional compensation to their base salary, is that something that the school board would have had to approve? So I think there's just too many questions. I think the spirit of what was negotiated in that joint meeting with the school board and the board of supervisors, I believe that one category for substitute nurses needs to be stricken from what we approved, just the entire block. And then we approve the funding tonight so that the school board can move on with their funding. Now, I have followed along school board meetings. I don't comment. I put in JB, that's it when I watch school boards, because if you're not informed, you don't know what you're doing. But I've listened to the school board. I do not envy the position they're in. I will say that flat out. I don't agree with everybody on the school board, but I also don't envy the position that they're in. With that being said, there was a meeting that I heard, maybe it was 2 months ago, where the discussion occurred about the different sources of funding that was available for CARES Act. There was a grant, there's the 2-year money that went directly to the school districts, then there was an additional fund that went in there, and then there was ours. And it sounded like the discussion was going around, well, we're gonna put things where it's strategic, where it's to our advantage. And I don't blame you. I would do the same thing. But I think that's kind of what happened here. And while we got a deluge of things in different categories, it was to get the money expended and then move on, because I noticed there's some other major purchases that the schools are making and obligating their funds. I was contacted by a constituent who was very upset, who works for the county school system, that said we didn't get our step increases this year, because you guys, the Board of Supervisors, cut our budget. We didn't cut anything. We just didn't fully fund a request. I want that clarity out there. But they said the schools said that we didn't get our step increase because you cut our budget. But then when there was discussion about this Honeywell thing, which isn't even 100% success, I guess is the best word. It's not going to cover all the facilities. There's no 100% guarantee this thing's going to be great. $750,000. There was questions, well, where are we going to make up the difference if we don't have enough CARES Act funding? And I heard operating budget. We can make up for it in our operating budget. That constituent called me as soon as she heard that, and she was ticked off because we were told that they were bare bones budget, and then a system like that, they can find the money in operating budget. So that's the kind of things that where I guess the school board and the Board of Supervisors marry. This has been a highly contentious issue in the county as far as opening schools, and schools are on the forefront. And like I said, I don't envy their position, but when they're asking us what we can do, we have no power. That's an independently elected body, but we do have power of the purse. That's why this audit is crucial. We have to review this and be that good steward of these dollars. And the rest, citizens need to engage their school board. So, thank you.
Thank you. Ms. Kupka?
So as an alternative, I would offer that we take the line items under nurse substitutes that have the names next to them, and we add them up, and I've added them up 3 times now, and I've gotten the same number, $5,537.02. And that when we move, the motion is that we subtract that amount from Dr. Young's recommended request, because it seems like that is the greatest uncertainty here that Dr. Benson wants time to look into, and it's $5,000. We've heard that all of these other expenditures are in line and legal with the CARES Act guidance. Did they match up line by line? No, but in the interest of moving forward and having this approved in time for the December 30 deadline without us needing to have another meeting to do so, that would be my recommendation. Thank you, Madam Chair.
Thank you, Ms. Kupka. Mr. Stonehill, I'm going to give you another opportunity to weigh in.
I would agree with all the other folks had said. I think that the things that they spent them on were justified. Except for this whole part about the nursing, I mean, I'd be good with all that, except cutting some of that out of it as well.
Mr. Granger?
I don't have anything. I don't have anything else to, I guess, weigh in on. If that's the easiest way to go, and as Ms. Kupka said, it's only about 5K. That might just be the easiest way to move forward. And I'd say let's go that route.
My last statement on this is I understand both sides, and all of us are in an uncomfortable situation because either way we go, we're going to look bad to somebody. And for our elected officials who serve on the school board, we've been in uncomfortable positions on some of the decisions, especially Mr. Granger, Mr. Bush, and I've made for the last 3 years. And sometimes I think they're in a worse position of having all eyes on them in an unprecedented time. But with that being said, we hear a lot from constituents wanting us to have more information. And then we also hear from a lot of misinformation from people saying, why aren't we getting our raises? Or why aren't we getting this? And they look to Stafford and Spotsylvania. And I just wanted to make a point, just like Mr. Bush made a point, is as many people know, I'm on GWRC. So I interact with the chairmen of all the regional localities. And we had a meeting, and the Stafford chairman told me how much CARES Act funding they got, which was around $50 million. And they gave out to a lot of different groups. They gave to the library, they gave teachers increases. But just think about that. They have about 170,000 people. So all this money was allocated based on population. And so they were able to get $50 million. We did not get. We barely got $5 million. So when you have $50 million as opposed to $5 million, you can give to a lot more entities. So we only got a very small amount of money, just like Caroline got a very small amount of money. So we have to be very careful with what we purchase with it to make sure all the citizens of King George, not just school children and teachers, but our firefighters, our staff, the general public, are able to have these CARES Act funds to benefit this trying times. So I just want to make that aware to the public so they understand. I mean, you read a lot of in the newspaper, but most of us, you just give us a call or send us an email, and we'd be more than willing to talk to you and explain it. Sometimes it's very complicated, but understand the school board is a separate elected body. The Board of Supervisors is a separate elected body. We just control the purse. The school board makes their decisions and very uncomfortable decisions they have to make this year about the schools. So with that being said, I will leave it to my colleagues, whoever wants to make a motion.
So before the motion's made, I like what Ms. Kupka suggested. I would just, would you guys be open to striking the 2 cleaning wipes, one for $5,151 and one for $343, and then the 2 HEPA air filters? I believe those 2 things those aren't in line with substitute nurses. If those 2 lines would be stricken out, and then what Ms. Kupka suggested, I think I could go along with that.
Mr. Bush, which page was that on?
Madam Chair, can I just clarify for the public, before there's some assumptions drawn?
Go ahead,
the HEPA air filters and the wipes, those were for those isolation rooms and nurse station in particular. So the ionization system, while it will benefit the building wide, given the nature or the anticipated use of those relatively small spaces, that's why the supplemental HEPA filters were purchased for use across all the schools in those particular rooms. I just want to clarify that so that it's not assumed that those were just HEPA filters bought and the expense stuffed underneath of that heading.
Dr. Benson.
They were there to facilitate those actual rooms in line with the description out to the right.
Would you just
thank you for the opportunity to clarify.
Dr. Benson, when you just explained that, when I toured a couple of the courthouses when I did with Vic Mason, they showed a couple of those isolation type rooms, and they were for prisoners who might have an illness. So your isolation rooms do not have venting out to the into the air, right, to the environment. Those did. So these would be rooms that you're repurposing to be an isolation room. So they would be part of the general air system, correct? They have no vent to the outside.
Correct. They would be within the building, which would obviously be part of the general HVAC system. I'm not sure what you're referring to as far as ventilation outside. I mean, the building will draw a percentage of fresh air across the building.
Right. Well, where I'm coming from is you were just trying to talk about the HEPA filters. And so.
Yeah, I just wanted to make sure that people didn't think that we just bought HEPA filters and the expense for that. You know, HEPA filters to service the schools in general, and the expense was just stuffed underneath of that heading. That's not the case at all. You know, those filters then are placed in those particular rooms, the isolation room and the nurse station, in alignment with the description out to the right for that heading. So I'm not trying to debate. I just want to clarify that so it's not left out there as if we just bought HEPA filters on top of something else for the heck of it.
Well, why I'm trying to ask the question is because I know I can hear coming from a constituent going, you have the Honeywell system, they're for the rooms, why doesn't it service that room? Why do you need an extra HEPA filter? So I'm trying to give you an ability to clarify why in these rooms that are serviced by the air system of the building, why they need an extra HEPA filter. That's where I'm trying to go here.
Yeah. And I appreciate that. It was just to provide extra assurance, given the obvious nature of those spaces would be more likely utilized by suspected cases or by students or staff that would be symptomatic. And so to provide extra assurance and to reassure our staff in particular, that's why we chose to then equip those rooms accordingly. As a supplemental way. And actually, I think that the purchase of those HEPA filters may have even predated the procurement of the ionization system.
That's the other question I was going to ask you.
Anyway, that was the spirit of it, was to just make sure that we were doing everything we could to equip those rooms appropriately, given the needs we anticipate and still anticipate will be fulfilled in those rooms.
And that's why I was asking, were they a previous purchase before you purchased the ionization system?
I have to look at my suspicions, yes. I'm looking on the sheet to see, but the ionization system was finalized relatively late in this period of time. So if you can help me find that, I can try to judge from the payment date. I'm just trying to reference it on this spreadsheet here.
I don't think we have that because that was a school board decision and using school CARES Act funds. So that would not be in our audit report. So.
No, I was just looking for the date of the HEPA filter. Okay, so that's October 9th. So yes, the HEPA filters would have been procured for the ionization system.
All right, thank you, Dr. Benson.
And Dr. Benson, I appreciate you for providing that clarity. My point is just, I would view that as facilities, not as nurses. I understand the justification and what they would be utilized for, and the two tie together, but it's not a nurse for in-person or substitute nurse for in-person return. I believe if you look at the minutes, the way that discussion went, none of these items really fit into what that discussion was at that point. At the end of the day, we want to see our students get back in school. The money's going to have to be made up somewhere because these expenditures were already made. We just need to, this isn't our money. This is taxpayers' money. And people say CARES Act money. It doesn't grow on a tree called CARE. It comes from taxpayers. It's borrowed money from China. Whatever you want to call it, it's real money that belongs to somebody else, and we're utilizing it for people to give them a return on their investment, which this is what it is. So ultimately, we want to see the kids back in school. We want to work with the school board, because it's already been purchased. But we do need that. We got to get to a point to where when somebody approves a line item to the constituents out in the public, when they're watching our meetings, they're like, okay, They approved that line item, and there's not going to be anything outside that zone that you're going to spend my money on. That needs to be the future. It can't be government just spends whatever the hell it wants because it's not our money. You know, we need to get to a point to where line items mean something, budgets mean something, and that's what I want to see in the future. But at the end, we got to make this happen. So,
no, I'm with you there as far as the transparency and the accountability. Do keep in mind, and you mentioned, Ms. Bender, that this total pot of money was approaching 5 million, I believe. Well, we're discussing 1 million of it, so I assume the same scrutiny will be afforded the remaining 4 million in CARES, county CARES.
Yes. Yes, Dr. Betcher. I just wanted the public to know and understand, especially when they see in the paper and they see things that happen in Stafford and Spotsy, that the big discrepancy of what King George was allocated for CARES Act funding. I'm sure it's for the schools too. Stafford and Spotsy got a lot more in their CARES Act school funding than King George did. And I don't think the public realizes that. They just read the paper and they see the numbers and they wonder why they didn't get theirs. And they have to understand that it's based on population. And Stafford has 170,000 people, probably more in the new census totals, and we don't. I have my colleagues. Anybody want to make a motion?
Yep, bear with us 1 minute. Madam Chair, I have someone checking my math.
It's all right. It's always good to check. And thank you, Dr. Benson, for coming to answer our questions. I do appreciate it.
Very welcome.
You didn't know you'd come to a board meeting and have math class.
With that, I move that the King George County Board of Supervisors authorize the payment of the school's CARES Act expenditures in the amount of $971,432.83.
second.
Any further discussion? All those in favor say aye.
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 Any nay? Chair votes aye. Motion carries. I know there's a school board member in the audience. If you could just hold on a second until I would like to give you something. So just hold on a second. With that being said, thank you, Dr. Benson. Once again, we'll move on to the county administrator's report.
Madam Chair.
Go right ahead.
This is Matt. So you made an allocation as a sub-grantee to the school boards previously, and now you're authorizing the payment of less. I think it would be appropriate to have a motion to remit the remainder back to the county because Neiman will have to apply that. So you have a motion out granting as a sub-grantee more than you're going to pay.
All right. Ms. Kupka.
Thank you, Mr. Britton. So I move the return of $5,537.02 that was previously appropriated to the King George County School Board CARES Act spend plan to return to the King George County CARES plan.
If I may, Madam Chair, I think it has to be the original amount of, I'm sure Dr. Young has it, of $1 million plus dollars.
Right.
Because this is going to be the entire expenditure.
Right, because
So it's
also
not just the delta between today and what you approved for payment. It would be the delta of what you approved to the subgrant originally and what you approved today.
Okay.
So, Mr. Britton, you're talking about the $55,000 delta too, right?
Yes, yes, exactly. So the motion would be you've made the motion to pay these expenditures under the subgrant CARES Act to the school board, and then to remit the difference between this motion today and the original subgrant amount back to the county. Because currently that's tied up as school board subgrant money. And Dr. Young's going to find himself in a position where he can't allocate it to the county without that motion.
Thank you. I apologize, and I missed the other $55,000 that we were looking at tonight. So then I would move to remit the difference from the original appropriation in the amount of $60,567.17.
Second.
Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye. Motion carries. Is that all we needed, Mr. Britton?
Yes.
Okay. Thank you for that clarification. Dr. Young, your administrator's report? Thank you, Dr. Young. I gave a copy of the audit and the original request to the school board member that is in the audience. So Dr. Young.
Oh, I'm sorry, Madam Chair. My microphone was off. Can you hear me?
Now we can.
Okay. Yes, I just wanted to state that I did receive correspondence from Mr. Adam J. Siminoff, and he had requested that I carry correspondence to be placed into the record. So I just wanted to briefly summarize the subject matter of his correspondence. Mr. Siminoff believed that the King George Board of Supervisors is trusted to maintain public county real estate and not dispose of it without the consent of the governed. He believes that previous King George Board officials failed to meet that obligation to maintain land as a public trust for the enjoyment of King George County citizens. And he suggests that the Board of Supervisors consider adding any future land transfers of county-owned land should be handled via a referendum on a ballot. And I just wanted to make sure that that correspondence is placed into the record.
Thank you, Dr. Young.
Second, as the board is fully aware, we are rapidly arriving at the deadline for the current declaration of emergency to be exhausted, which is December 31st, 2020. And I placed a recommended declaration before the board for you all's consideration. I will read it aloud for the public awareness. It states, whereas the Board of Supervisors of the County of King George, Virginia finds that from March 16, 2020 through December 15, 2020, a local emergency has been in effect, and that there exists a continuing threat or actual occurrence of an emergency or disaster as a result of the then COVID-19 pandemic that is or threatens to be of sufficient severity and magnitude to warrant coordinated local government action to prevent or alleviate the damage, loss, hardship, or suffering threatened or caused thereby as defined by Virginia Code 44-146.16, being as a communicable disease or public health threat. and that in the particular contracting and financial tools available to the county resulting from a declaration of local emergency are particularly useful and necessary to mitigate the threat and harm from COVID-19, especially in light of the CARES Act funding and use restriction that includes obligation and receipt of eligible expenses for March 27th through December 30th, 2020, and any subsequent CARES Act funding as may be distributed to the states. Now, therefore, it is hereby declared by the Board of Supervisors of the County of King George, Virginia, that a local emergency exists and continues to exist throughout the County of King George, Virginia, and it is further declared in order that during the existence of this emergency, powers, functions, and duties of the Director of Emergency Management and the Emergency Management Organization and functions of the County of King George are those prescribed by the laws of the Commonwealth of Virginia and the ordinances, resolutions, and approved plans of the County of King George in order to mitigate the effects of said emergency. This state of local emergency shall end when this condition of peril has abated or at midnight on January 19, 2021, unless otherwise extended under law. Signed, Board of Supervisors of King George County, Virginia. I'd recommend that the board consider approving the declaration of emergency as presented.
So moved.
Do I have a second?
Second.
Any discussion?
Thank you, Madam Chair. So I like this declaration as I did last time because it describes the financial tools at our disposal, so I can support this one. The only thing is, I think the termination date of 19 January just isn't realistic. I think we're going to find ourselves here again saying that, hey, we're going to extend this declaration, and then we're going to extend this declaration. Is there a way that we can put in a metric or something to where we can make a reasonable determination when it's time to execute this declaration of emergency? I mean, it is a financial tool that we're using. We're monitoring everything. You know, I want it to mean something. I just don't want it to be, we're under a declaration, you know, and they're going to renew it every 30 days. Is there a way we can address this date? Because I know that's what's going to happen. Anybody have any suggestions? Or I know it's already been moved and seconded, but maybe we can just address it in a future declaration, because I do foresee this going through maybe the spring.
How about if we just, go ahead.
I was going to say, I agree with Mr. Bush's points. I know a lot of this had to deal with financials, and it's not necessarily that those are gone once the CARES Act funding is gone, since it still allows us to purchase in a state of emergency and suspend some of those regulations. So, you know, I'm not necessarily saying get rid of it, but, you know, a lot of it as well was the CARES Act funding and making sure that we didn't lose that access to that. And so once that expires at the end of December, to me, you know, some of the motivation for this kind of goes away, and I would like to understand what the end game is. I think that was a really good question from Mr. Bush. You know, how do we identify done?
I was going to make a suggestion that we go with what it is and direct Dr. Young for the next one. When it comes up, it gives them enough time. It gives them, over 20 days to come up with with Mr. Britton, some kind of metrics. Chief Moody can be involved in it, and to make this a little different and a little more information and metrics, maybe. Is that what you were looking for?
Metrics.
Yeah, metrics of
something measurable.
Tangible.
Or, you know, or if the metrics are going to be Rappahannock Health District, you know, because this could be flat and go away in a month. The numbers could keep being out there, and if that's the metrics that are being used, and we get another allocation of CARES Act funding or something, you know, what are we using to have this date? Is it an arbitrary date, or is it a targeted date for something? So maybe instead of it having a finite date, we can have some kind of metric that is met, some benchmark or something in there to say when this is achieved or met, or at this discretion of the board. I don't know, but something more than an arbitrary date.
I would agree with that. I've signed a lot of these this year. Hopefully, Ms.
But we're not going to solve that tonight. So, I mean,
it's something if you could look at, Dr. Young, but we have a motion properly seconded, and we have I'll end the discussion and we'll go for a vote. All those in favor say aye.
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 Any nay? Chair votes aye, motion carries. Dr. Young?
Thank you, Madam Chair. And I did receive the board's guidance, and we'll definitely work on metrics. I received correspondence from Ms. Ann Bush, the chair of the Comprehensive Policy and Management Team, or CPMT. Ms. Bush would like to request that Ms. Donna Hahn be appointed to the CPMT and that the attached list of current members be reappointed for calendar year 2021.
Didn't we do this the last meeting? Dr. Young?
Excuse me, Madam Chair?
Did we do this last meeting?
No, ma'am. This is
Or is it
Donna
this?
Hahn. Donna Hahn was not on.
It was not on the list.
That's
Okay.
correct. I believe that at the last meeting with Jonathan Franklin.
Okay. So just clarifying. So do I have a motion?
So moved.
Second?
Second.
Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye, motion carries. Dr. Young?
Thank you, Madam Chair. I received correspondence from the State Compensation Board. The General Assembly and the Compensation Board have approved the allocation of funding for a $500 bonus for Compensation Board funded sheriffs, sheriff's deputies, superintendents, and regional jail officers. For King George County, this funding will account for the payment of the bonus of 18 of our sheriff's deputies. Unfortunately, the funding does not afford the same bonus to 22 of our deputies who are not funded by the State Compensation Board. As a result, the sheriff is requesting the board consider funding a $500 bonus for the deputies that are not covered by the Compensation Board. After discussing this request with the sheriff, I recommend that the board authorize a $12,000 be transferred from the general fund balance and appropriated for funding a $500 bonus for deputies in the non-compensation board funded positions.
Do I have a motion?
May I ask a question? I know
Go ahead.
it's not been moved, so it's not really discussion, but Dr. Young, is there a reason that it's $12,000 and not $11,000?
The actual number would be, and I was discussing that with the sheriff today, 11,300. However, I'm giving a little wiggle room, as you know, if there is someone that's hired or somebody departs or whatever dynamics are take place with personnel in the sheriff's office. I just wanted to make sure that we had wiggle room to ensure that we can ensure that all deputies, all the sworn deputies are compensated across the board.
So I'm okay with the $12,000 request, but I just would caution us to make sure that for some of these categories, it's very specific about the time frame for which the employee had to work between, say, March whatever and whatever time frame. So I just want to make sure, like I said, I'm okay with going forward with the 12,000, but that we ensure that we are in compliance with whatever the time frame requirement is before we give some new person the $500 bonus that maybe really isn't entitled to it because it was outside the time frame. That's all.
Roger, ma'am. The sheriff and I are definitely on top of that. And to include finance, we just wanted to make sure that we had enough funding to appropriately compensate the sheriff's deputies. Whatever funding is not used will be returned to the fund balance.
Do we have any further questions? All right, ready for a motion?
I move to transfer $12,000 from the general fund balance and appropriate it for funding a $500 bonus for deputies in non-comp board funded positions as presented.
Second.
Any further discussion?
I just want to add one thing. State Compensation Board has been lacking for years, and it's ridiculous that they don't give the numbers that they should be providing to the sheriff's office, and that local has to cover so much. I wish we could give them more. Public safety is going to be hurting soon. I had a conversation with Chief Moody, following up after some information Mr. Stonehill gave us, especially on the fire rescue side. Public safety compensation is biting us, and it's gonna bite us. We need to do something, and I'm glad we're able to do this for the sheriff's office, but State Compensation Board has not done their job. They have not been true to their mission, and they're pitiful. And I just wanted that on the record. So that's all I have for discussion. Thank you.
So we have a motion, seconded, discussion. All those in
Madam
favor?
Chair,
Go ahead.
I apologize. Given what Ms. Kupka said, I wonder if Ms. Kupka wanted to amend the motion to state under the same terms and conditions as set forth by the comp board.
Thank you, Mr. Britton. I wish to amend my motion, my original motion, to add under the same terms and conditions as set forth by the state comp board. Did I get that right, sir?
Yes.
Thank you.
Second.
Properly seconded, amended motion. Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye. Motion carries. Dr. Young.
Yes, ma'am. I'd like to request that the board authorize $125,540 be transferred from the general fund balance to the general fund to address employee compensation for public safety employees.
So moved.
Second.
Any discussion? All those in favor say aye.
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 Aye. Aye.
Any nays? Chair votes aye. Motion carries. Dr. Young.
Yes, Madam Chair. This is the last meeting of the year with no date published for the first meeting in January. I would like to recommend the board authorize the the county staff to advertise a board meeting for January 5th, 2020 at 6:30 p.m.
Do we need to specify the location?
We
know it's gonna be.
Why don't we just say the high school?
Okay, well,
We know
high
it's gonna
school.
be
I
here.
just want to
Going
make
anywhere.
sure. All right, so do we have a motion?
I move to authorize the county administrator to advertise a board meeting for January 5th, 2020 at 6:30 PM at King George High School.
Second.
Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye. Motion carries. Dr. Young.
That concludes my report, Madam Chair.
Thank you. Ms. Kupka.
Stand by, Madam Chair. Is that, Mr. Beal, is that you? It's really dark. It's hard to see. I apologize, but we do have a representative from VDOT here, and he's provided his department or a report in the department reports section. And he's waited very patiently for quite a long time to present it, I think. So if we can hear from him before I move to closed session, please.
Yes, and I apologize. You were sitting there. I remember I recognized you, but I didn't recognize you. I just thought you were a great representative of our public. I apologize for not recognizing you, and I'm glad Ms. Kupka caught it and you can speak. So I apologize once again.
Madam Chair, thank you. I just assumed you all were saving the best for last. So-
Well, there you are. Best for last.
I appreciate the honor. I do have a report, and I just wanted to start with a compliment. As I rode through Route 3 on my way here, I thought the Christmas lights were really, really nice. And I was particularly taken back by the snowflake. It's such a dichotomy inside of me. I've always just loved the snow, and now I feel like I'm betraying my coworkers by loving the snow. But in the spirit of the oncoming storm, we are ready. You may have noticed that we brined Route 3 today. If you could see 301. We also did 218. If you can see those white stripes down the center of the lanes. That is the salt water dried on the road in anticipation of the precipitation for tomorrow. So we are ready for that. And I also wanted to thank Mr. Stonehill. We talked about the anti-litter campaign the last time I was here, and I did see an application for Adopt a Highway come in under his name, and I appreciate your leadership in that regard. The maintenance activity highlights I'm just going to be very brief. We've gotten a lot of citizen requests regarding gravel roads with all the rain. There obviously are the easiest ones to wash out in the storm events. We've addressed about half a dozen of those in the last 30 days, and we're continuing to work on those. We also had a request for a pipe to be cleaned out on Igo Road at Strawberry Hill, and we have worked on that with the pipe truck this past week, and we're continuing to work on that until we solve that issue. The mowing has been done, the primary routes are done, all the litter was picked up, and we continue to work on ditching and repair washouts and replace pipes, and we're also continuing to clean the curb and gutter on Route 3. And we'll continue to do so over the next month. The second part of the report and the construction projects, all of our construction is complete in the county for this year. We do have the secondary 6-year plan projects. If you remember back in the spring, we allocated all of the secondary 6-year plan allocation was deposited into a countywide category. And so hopefully this spring, when we get our allocations, we'll have double the amount to allocate to the projects that are of your priorities. Smart scale projects are in the out years. There's an HSIP project there, shoulder rumble strips in 2024. And I did add 2 projects that hopefully won't impact you or the citizens much at all. I really put them there for my own benefit so I could keep track of them in case there are some traffic impacts. But those are the last 2 there on Pine Hill, on 301 over Pine Hill Creek and 603 over the railroad. There's a beam in repair project on a bridge and a scour repair project. You know, as the water moves through the structure, it creates scour at the structure, and the structures are inspected regularly. And when the scour becomes too deep, we have to go in and repair that. And so it's a part of a routine maintenance program. I don't anticipate any impact to the structure or the traveling public, but I just wanted to keep them on my radar, so I added them to the report. And lastly, I'd be remiss if I didn't mention our customer service line, 1-800-4 road, FOR road. I'd encourage citizens to create work orders by calling the number and talking to one of our customer service representatives. They will get a tracking number and be able to keep up with that request. And that is the most efficient way for their issues to be resolved. With that, that's all I wanted to present. And I'll take any questions or comments you all have.
Does anybody have any questions?
I was with the folks from Friends of Rappahannock the other day, and I know they were very interested in getting together with you guys and for trash pickup on 3. And I can reach out to those guys and send them your information, but that was something they definitely wanted to get after. I know today I drove into town and there was a lot of trash on 3, but I think that's something we just have to get used to over there. Then I was out at Kings Mill Road the other day. I did talk to Keith about it, and I mean, it was so bad I could almost not even get through. So he said that was something that's upcoming, but okay. I know you guys are busy. I know the winter is coming, but you know, I certainly appreciate everything you all do.
Ms. Kupka?
Thank you, Madam Chair. I wanted to say thank you for following up on the Strawberry Hill complaint and the jail crews cleaning the medians. I am so overjoyed when I drive into work in the morning and I see the big blue VDOT bus parked on Route 3 working those medians. The citizen that suggested that to me months and months ago notices every time also, and she emails me or hits me on Messenger regularly, so thank you for keeping up with that. Just two other things, and just because they've been sources of ongoing issues that Mr. Stonehill and I both have had to deal with so that citizens can hear. I called you again last week or the week before about Matthias Point Road. Is there an update on the ditching or when the last time that was done? And then the other one is the situation at Bayberry. It sounded like you had resolved it, but if you could just briefly speak to that, please.
Matthias Point, I'd say we're still working on. We need to do some courthouse research and look into easements and who owns what easements and what we can do and who we need to partner with to make things better. And I think at the end of the day, that's going to be our message, that it's going to be a partnership between VDOT and the landowners to try to keep those drainage ditches clean. They go a long ways off the right of way. And, it's beyond our purview to clean ditches, until they daylight to the river. So we'll look for ways to partner with them to solve those issues. And I'll continue to track that and make sure we follow up. Bayberry, my understanding, the ditches are flowing through Bayberry. There's a lot of water that moves through Bayberry. But I'm not aware of anything that's stopped up or that needs to be cleaned. It's just a low area that moves a lot of water. So when we get rain, they get a lot of water in those ditches. And that's just the nature of the beast. So I'm not sure that I'm not aware of anything for us to do there to improve that situation.
Thanks very much for all of your assistance. We greatly appreciate it.
Thank you.
Mr. Bush? Mr. Granger?
I don't have anything else. Just say thank you for coming out. It's been a long night, but I appreciate you staying out and echo Ms. Kupka's thanks, in particular for the Strawberry Hill. So, thank you for looking into that and working to resolve that issue.
You're welcome.
I'll only bring up the two that'll start to come up. I know I'll get my constituents is Big Timber Road, which I know you know about. This basically the part that turns into gravel, where it goes from the macadam to the gravel. About this time of the year, I start to get complaints about the potholes on the gravel part of Big Timber. And then Alden Road, where the water washes out because there's a swamp there that comes across the road. If you could just look at those, because I know in the wintertime, I always start to get constituents start to be concerned about that. That's all I point out. I do appreciate, especially the mowing on Eden Drive. I know I met with you about that, and it looks great. You can actually see both ways, especially for small cars going down that little dip, I'll call it, where near Ralph Bunch. I really appreciate the mowing. It looks much better than it has done in the past, and I appreciate it. And I truly appreciate you sitting here through a long meeting.
No problem.
Thank you very much, and I'm glad you at least got to enjoy the lights.
Yeah, I'm going to look at them when I go back through too.
And thank you. And I did notice the conditioning of the roads when I went to the county administrative building earlier today. I noticed when I came back home, you had already put stuff down, the brine down on Route 301. And I appreciate it because coming from up north, I noticed it right away. Right. Thank you. And have a Merry Christmas.
You too.
All right, Ms. Kupka?
I move that the King George County Board of Supervisors convene in closed meeting pursuant to State Code Section 2.2-3711A1 for the discussion and consideration of the performance and compensation of the county administrator and county attorney.
Second.
Invited to attend the closed meeting as necessary is the county attorney because he is deemed necessary and his presence will reasonably aid the board in its consideration of the topics to be discussed pursuant to Virginia Code Section 2.2-3712F.
Go ahead.
Second.
Any further discussion? All those in favor say aye.
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 Chair votes aye. Motion carries. Mr. Britton, we will call you once we get in there. Oh. Is he good? Richard?
Yes, ma'am.
Oh, here we go. Rita?
I move that the King George County Board of Supervisors return to public meeting and certify by vote that only public business matters lawfully exempted from open meeting requirements by Virginia law, and only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered during the closed meeting.
Second.
Mr. Stonehill, do you certify?
So certified.
Ms. Kupka?
So certified.
Mr. Bush?
I certify.
Mr. Granger?
So certify.
Kathy Bender, so certify. We are back in open meeting. Ms. Kupka, you have two motions.
I move to increase the 2021 compensation of Dr. Neiman Young by 3% effective January 1, 2021.
Do I have a second?
Second.
Any further discussion? All those in favor say aye.
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 Chair votes aye, motion carries. Second motion.
I move to increase the 2021 compensation of Mr. Matt Britton by 4% effective January 1, 2021.
Do I have a second?
Second.
Any further discussion? All those in favor say aye.
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 Chair votes aye, motion carries.
I move to adjourn to the organizational meeting on January 5th, 2021 at 6:30 p.m. in King George High School auditorium.
Second.
Any further discussion? All those in favor say aye.
Bye.
Aye.
Chair votes aye, motion carries. This meeting is hereby adjourned to the next regularly scheduled meeting on January 5th, right? At 2020 at the King George, 2021, excuse me. I'm just trying to get that in there at the KGHS auditorium. That meeting may be held by electronic means and or remote participation only and may be closed to the public being physically present. All citizens are encouraged to participate in advance or during the meeting by electronic means as provided by the county. I want to say Merry Christmas to everybody. I'm leaving my center square for the year as chairman, moving over to the side. So goodbye from